Hi, I'm Dr. Silvester with Next Step Foot and Ankle Clinic.
And I'm Dr. Larsen with the Next Step Foot and Ankle Clinic.
We're going to talk to you today about fungus. It's a pretty broad topic. There's a lot of people that have it. It applies to a lot of people. We're all living in a fungus world. If you take a piece of bread that's wet and put it on a clean table, in a few weeks it'll have a mold on it. So fungus is pretty much everywhere. The type that grows in your skin maybe not be everywhere, but it's pretty common. So I just say it's probably more a genetic disease than a dermatologic disease where you stepped in a fungus pile and got a lot of fungus on yourself.
So in essence, you can blame the fungus on your parents.
There you go. Yeah, don't blame yourself. People that don't wash their feet frequently can have probably more propensity to having fungus. One thing I used to notice when I was in high school, a lot of the kids that swam got nail fungus from swimming. I think that had something to do with the chlorine in the pool wiping out the normal glands that secrete the oils that inhibit the fungus. So.
And we'll also see patients that go to nail salons, and whether they're clean as far as the utensils that they use to trim their toenails, a lot of times something happens where they'll get introduced to fungus and then they make their way here to see us.
That's a good point. We certainly see that. I think everybody kind of knows what a nail fungus looks like. It looks thick, yellow. But one of the things that my patients are quite surprised to find out is that they come in saying, well, my feet are really dry. And dry skin is usually a fungus. And most of the patients that I see where they have we call it a moccasin type rash where the bottom of the foot's dry and scaly, that's usually not just dry skin, that's usually a fungus infection.
You have to pay attention to your toenails and keep an eye on them. You may just notice a small little patch that just continually gets more and more developed. The biggest thing with fungus is if you can catch it early, you can get rid of it pretty quickly. But if you allow it to develop and really ingrain itself into your toenails, then it becomes quite an issue, and then we're throwing a lot of things at it.
Yeah, we're in the early stages, a lot of times it'll just show up like a little white discoloration of the nail just right out where the end of the nail is. You'll see it on the border, a little white discoloration. If you see something like that, that's usually a warning sign that there's something going on.
And since the patches of fungus typically make their way underneath the nail, you'll start to even notice a little section of the nail that might start lifting to where you can kind of dig even underneath it, because the nail is no longer attached to the nail bed because the fungus has taken its place.